My name is Alice Benjamin. I am a family nurse practitioner currently working in the emergency room, but I'm also a clinical nurse specialist, a medical correspondent for TV, and the chief nursing officer consultant at Nurse.com. I've been in healthcare for 24 years. I started as a CNA, then I became an LVN, then an RN with associate's degree, bachelor's degree, and then I got my first master's in nursing education and clinical nurse specialist, and then went on to get my postmaster's as a family nurse practitioner. And yes, I will be on the doctoral DNP journey very soon here. I love every bit of it. I started on a tele step-down unit, then shortly thereafter went to ICU, but I've always worked in the critical care arena, focused on cardiology. That's my passion, that's my love. And then I veered off into emergency medicine. I never thought that I'd go into the ER because my reason for why I became a nurse is because my dad actually died of a massive heart attack in the ER. So full circle, now I'm a provider in the emergency room, helping to direct teams that can care for people who are like my dad. You know, I've enjoyed every bit of nursing. I've had a very scenic route in nursing, and I wouldn't change one thing.
How have mentorships contributed to your professional development?
Nursing mentorships have definitely played a very important role in my career trajectory, my journey, and the fact that I'm even still a nurse. Because in nursing, there are so many challenges and obstacles and things that we just can't anticipate, not only with just direct patient care, but just in the workforce environment that are very challenging professionally and personally. And thankfully, mentorship has played a very important role. And in fact, nursing mentorship contributes to an atmosphere that helps other nurses and nursing students to achieve self-advocacy. It helps with providing a supportive framework that empowers nurses to voice their needs, concerns, and aspirations confidently. I still have a mentor. There's never a point in your career, even if you're a mentor now, you probably still have a mentor yourself. My mentors have helped me navigate the complexities, that's an understatement, of healthcare. Even when I was a newer nurse, and you're still finding your voice, they've taught me how I could advocate, not only for the patient, but for myself, stand up for my professional rights and responsibilities. And you know, this one-on-one guidance that mentors provide helped me to boost my confidence, and it helped me to make some very important decisions in my career, especially when I was experiencing challenges in the workforce. And I'll just say this, having a mentor helped me to feel supported and like I belonged in nursing, especially in those moments where I was questioning, is this for me?
Describe a time where you felt supported by your nursing community.
I can think of several times. I'll just point out to one where I think was a very pivotal moment, which was early on in my nursing career. I remember early on in my career, I was a new grad. I just finished preceptorship, so I was officially on my own, right? My preceptor was working the same shift, but I was on my own patient load and everything. And I had my first code blue. Now, theoretically, I'd studied it, I'd done simulations, I've gone over it, I've done the packets, I've done all the learning, but when you're in it, there's a sense of urgency and fear that kind of just rushes you. And I know I'm not alone when I say this, but it's almost like all the smarts in your brains like escape. You're like, what do I do? You're so overcome with fear. And so I'm in the room with my patient, and my preceptor who I'd worked with wasn't there that day, but I had a team of nurses who I had worked with, and I was, if I can say, I was just scared. I was so frightened, afraid, and didn't know what to do. I was like frozen. David was the charge nurse that was on. I guess he recognized the deer in headlights look. He's like, Alice, it's going to be fine. He said, what I want you to do is just go and be the official pulse checker, and I'm just going to walk you through this. You're going to be fine, okay? And he did this kind of in a very discreet manner, so no one knew that I was so overcome with fear that I was stalled in some of getting this information out. Instead of like eating your young, which sometimes we've heard this concept, I had some really supportive nurses with me in the room that were kind, that were gentle, that were nurturing. And they actually just really walked me through that whole experience. After the code blue, all of those nurses kind of checked on me a little bit, and they gave me some feedback, but they were very supportive with giving me the feedback, and then, you know, following up with me, helping me with the charting afterwards. And I know that seems like just one example, and although we would like to think that that always happens, sometimes that happens in workplaces, but people aren't as nurturing. It's more of a gotcha moment. That's where we refer again to eating our young. And again, I'm a new nurse, so I'm not really sure what nursing community is supposed to look like. I don't even know that that's a thing. But after that day, I felt it. So I knew what nursing community was by experiencing it before anyone could ever tell me really what it was. But to have a group of nurses to be that kind, nurturing, supportive, and also jump in and help me. And I really appreciated that. That helped increase my knowledge. It helped increase my confidence. I felt supported. I felt nurtured. And it positively impacted my professional development, because having experienced that, what do they say? Each one teach one type of thing. So based on that positive experience, that helped mold my learning and my teaching and how I handled future nurses to come.
How important is mentorship to nursing students?
I think mentorship is extremely important. It plays a vital role in not only nurses, but especially nursing students, because these are our formative years, if you will. Kind of like, like when we were born and we're little and we get experiences that help us develop our identity and how we're going to be. Same thing with nursing. You go through nursing school and there's this whole transformation. It's like learning a whole new language, a whole new planet. And so we come out of nursing school and it's like you gotta crawl before you walk, right? We've completed school, we've graduated, we've passed the NCLEX, we've completed our preceptorship, but there's still so much more learning to do. So imagine that as a nursing student, I should say. And this is interesting. Obviously, I've been a nursing student, but I've also been an adjunct clinical professor. So I've had nursing students in the clinical place and I've guest lectured. So I've seen students in all the different elements, classroom, skills lab, and in the workforce. And it is fundamentally important for nursing students to have community and mentorship throughout their career. You don't wait till you're a nurse and then you find nursing community. I think we're okay in nursing, but I think there's so much more work that we can do in this. Now, it's not to coddle anyone or anything like that, but golly, it doesn't have to be that hard on our future nurses. And I think especially after the pandemic, when so many people have left the bedside, and then also with historically, like even with the Affordable Care Act, which granted more people access to healthcare insurance. And then let's be honest, there are people who don't have healthcare insurance that still access the ER. So either way, we have a growing population of people who are living longer and with more chronic illnesses and that need care. So we need healthcare providers, nurses, which again is the largest segment of the healthcare workforce. We need more nurses to enter the field and provide this care. And the only way we're going to be able to retain and attract people into the profession is if we're able to have this community and mentorship. A mentor is someone who serves as a role model, an advisor. They help advocate for you, teach you how to advocate for yourself. They help student nurses to understand the realities of healthcare, cope with challenges of the profession, make informed decisions about their career trajectories. And, this supportive relationship is what accelerates professional growth. It reduces turnover and it helps build a competent and confident nursing workforce.
What goals are you working on with Nurse.com?
I am so excited to have joined the Nurse.com family. And listen, we got a lot of great things coming down the pipeline. One of the things, I don't know if it's one, I'm probably going to say a whole bunch, but some of the things that we're focused on are creating and promoting opportunities for mentorship and community and engagement amongst nurses. Our key objectives include developing some online forums and some networks where nurses can connect, they can share their experiences and offer support. Full-time nurses spend a lot of their time at work. And so your workplace often takes on kind of the identity of a second family because you spend so much time with them. And same with nursing school. You have your family at home, but then your nursing school, your classmates, they become your family. And some of those places have really great communities and mentorship amongst themselves, but sometimes not. Or sometimes your aspirations are different from the location or the community that you're involved in. And so what we're planning to do at Nurse.com, and what I should say this, Nurse.com has been doing this, but now that I'm part of the team, I'm going to hopefully take it to the next level. And we're going to really focus on establishing some mentorship programs that help nurses match with experienced nurses and those who are new to the profession or seeking career advice, because sometimes you just want to pivot or you need something new or you just need some new insight into what's going on. So by creating this community at Nurse.com, nurses and nursing students will be able to connect and gather and talk with nurses from all over, from different specialties, maybe something that they're not even exposed to. They'll get to see, hear, and learn from nurses in specialty areas that they don't know anyone in, or they've never exposed them to, or they don't have that at their hospital. So that will be great. Additionally, we aim to provide resources and tools that support the development of mentoring skills. So not only do we want to help mentor nurses to where they want to go, we also want to mentor nurses so they can know how to mentor future nurses. Like I gave in that earlier example, David, who was kind of served as kind of the lead person in the helping me with that code blue when I was like a deer in headlights. That experience, that interaction with David in that high risk moment, and then the follow-up conversations that I had with afterwards, David didn't know this, but he showed me how to be a better preceptor and a better mentor to my colleagues. Not that I was a bad one at first, but sometimes just his style of communication, to see it enacted out, especially when emotions were heightened, fear, anxiety, workload, things competing. So we hope to create something like that to help mentor nurses to also be mentors to other. You need the tools, the resources, and the exposure to be able to do that. It's like learning anything else. You want to learn how to put an IV in, you need the equipment and you need someone to show you how to do it before you're able to do it. So we want to help develop mentoring skills that can facilitate meaningful mentor and mentee relationships. And overall, our goal is just to build a really strong, supportive nursing community that values growth, collaboration, and professional development. So we'll be doing a lot of that online, on the website, and through our Nurse.com app. And as well, I'll be working with some other folks at Nurse.com, Kat Golden being one of them. She's going to be charged with kind of the live events. And so we will have kind of the best of both worlds, online and in-person events where we can just really foster community, let people know hey, you're not alone in this nursing journey, even before you're a nursing student. While you're taking your prerequisites, trying to get into nursing school, we want to support you. We want to be there for you. Ask us any questions you have. Let us help prepare you for the journey so you can get through nursing school as easy and as quickly as possible. And then even as you enter into your nursing profession, we're here during your early careers. You need some CEs, we got you. Maybe you need to just let off some steam and have, social night out with nurses. We're here, we still got you. And even if you're an experienced nurse and you're like, I've been doing labor and delivery for 15 years, I'm ready to pivot. Hey, we're here for you still. So at the end of the day, my work that I'm going to be doing at Nurse.com is to let nurses and nursing students, and even before you become a nursing student, let you know that Nurse.com is here for you for all of your needs. We want to provide support. We want to provide community. We want to provide resources to help you be successful in your journey, because you're not in this alone. And again, if you want to go fast, go by yourself. But if you want to go far, we're here for you.